Hello students, welcome to today's class. I am Bernisha, lecturer from University College of Pharmacy. Today we are going to discuss about a new topic known as alcoholic liver disease from pharmacotherapeutics. We have already known that liver disease means it is a hepatic disease which may be caused due to the excessive consumption of alcohols. In this picture itself, we can know that excessive alcohol will changes the healthy liver into the fatty liver. So now let's see what is alcoholic liver disease, their etiology, pathophysiology, their management. Let's get into the video. First is what is alcoholic liver disease? In short form, it is denoted as ALD, the term that compresses the liver manifestation of alcohol overconsumption. That is, it is fully due to the overconsumption of alcohol, which may changes the liver into fatty liver and other conditions such as alcoholic hepatitis and chronic hepatitis with the liver fibrosis or cirrhosis. In usually it may be well represented as the oldest form of the liver injury known to our humankind. Many people with alcoholic liver disease experiences no symptoms in the early stage of the disease. Usually there will be the no symptoms in the early stage. When it is prone to the later stage of cirrhosis, we can find the symptoms such as abdominal pain, etc. So mainly the alcoholic liver disease is denoted by the overconsumption of alcohol. Next one is how much of alcohol cause liver damage. So we know that alcohol can causes the liver damage. So how much amount of alcohol can a person take a daily basis? So consumption of around 60 to 80 gram per day, about 70 to 100 milliliter per day for 20 years or more in men. Usually there will be the different amount for both men and women. So in for men it's about 75 to 100 milliliter per day, but for the women it's around 25 milliliter per day. So it mainly the women are more prone to the alcoholic liver disease as their liver can withdraw or metabolize certain amount about 25 milliliter per day. And the next one is the women have double risk of getting ALD when compared to that of the men. We have already know that based on the metabolizing capacity, women are more prone to alcoholic liver disease than men. And the next one is metabolism of alcohol. How this alcohol is metabolized. First, for the example, we are taking alcohol as the ethanol. It is oxidized with the alcohol dehydrogenase. That is ADH enzymes. With the help of that enzyme, the oxidation process occurs, which converts the alcohol into aldehyde. Here, the ethanol is converted into acetaldehyde. When acetaldehyde undergoes acetaldehyde dehydrogenase enzymes. In the presence of this enzyme, it is converted into acetic acid. So it is converted into further acetic acid. After that, with the help of acetyl coenzyme is synthesized. It changes into acetyl CoA, and after that, it enters into our citric acid cycle. So it enters into the further cycle. Here, if we taking the disulfiram, it inhibits the acetaldehyde dehydrogenase. So mainly the alcohol metabolized in such a way in our body. First, the alcohol is oxidized to aldehyde, then it is changes into acetic acid. With the help of the coenzymes, it is converted into acetyl CoA, and which enters into the citric acid cycle. And here, the 80% of the alcohol has passes through the liver to be detoxified. Mainly, it is to be detoxified. Chronic consumption of the alcohol, which results in secretion of the pro-inflammatory cytokines. We know that inflammatory cytokines means these are the mediators which can produce us inflammation to our body, such as TNF alpha, interleukin 6 and interleukin 8, which may produce us oxidative stress or lipid peroxidation and acetaldehyde toxicity. With all these, the 80% of the alcohol which passes through the liver to be detoxified. We have to detoxify the alcohol which has passes through the liver. Though the alcohol get consumed, these alcohol results in the extreme secretion of this pro-inflammatory cytokines, which produces the inflammation in the liver. Next, what are the risk factors? Here, the quantity of alcohol taken, or how much amount of alcohol we are taking per day. Here, we have already studied that the consumption is differ for both men and women. According to for men, it's around 60 to 80 gram per day. So that's about 75 to 100 milliliter per day. It's nearly about above 20 years of age. But in women, it's about only 25 milliliter per day or 20 gram per day. Here, the women significantly increases the risk of hepatitis or fibrosis, which is more than that of 7 to 47 percentage than that of men. Next is pattern of drinking. Drinking outside of meal times and increases up to 3 times of the risk of alcoholic liver disease. Though we are socializing the drinking habit, if you are not taken a particular meal at that time, which increases the risk of alcoholic liver disease, which may be the high risk for about 3 times. We have when the person is having the drinking habit, though he has maintaining his diet well, he have less risk for the alcoholic liver disease. And after that, gender means we have already know that the women's are have higher risk to alcoholic consumptions and alcoholic prone disease. Here women are twice as susceptible to alcohol related liver disease. And after that, hepatitis C infections. A concomitant hepatitis C infection significantly accelerates the process of liver injury. This hepatitis C infection, which increases the process of liver injury. Next one is genetic factors. Based on these genetic factors, which can cause us the alcoholic liver disease by the phenomena known as polymorphisms in enzymes. So these may alter the prone disease of alcoholic liver disease. And the next one is iron overload. If there is more iron overload, hemochromatosis conditions, then will be leads to alcoholic liver disease. Next is diet. So further, if you are socializing the drinking habit, though we have to maintain a proper diet. We have to particularly focusing on vitamin A and E. Mostly, the vitamin A and E deficiency can worsen the alcohol-induced liver damage. We have to take care of the good diet, and particularly we have to take vitamin A and D rich foods in our diet. Thus we can prevent the regeneration of hepatocytes. So these are certain factors which may leads to the high risk for alcoholic liver disease. One is our drinking habit or drinking pattern or a range of drinking or malnutrition, genetic factors or diet, iron overload, etc. So the next one is symptoms. What are the symptoms? We have already studied that alcoholic liver disease does not shows any early symptoms based on their early stage. So here the symptoms will shows how bad the disease is. The symptoms vary based on the disease. So you may not have symptoms in the early stages. Symptoms tend to be worse after the period of heavy drinking. So the digestive system symptoms includes pain and swelling in the abdomen. Always there will be some pain and swelling in the abdomen. Decreased appetite. The people will have the loss of lack of appetite, or they doesn't have any interest to take food, and it further leads to weight loss. And after while taking the food, it may leads to nausea and vomiting. They may be looking very tired. Its condition is fatigue, and the mouth will shows the dry mouth, and which will always increases the thirsty conditions. And the next one is bleeding from the enlarged veins in the walls of the lower part of the esophagus. It's like the internal bleeding conditions. And the next one is skin problems. First, we have learned about the digestive system symptom. Now it's the skin problems. There will be the yellow color in the skin, mucous membrane or eyes. Usually this term is known as jaundice. So the people with jaundice are more prior to the alcoholic liver disease, or the people who having this alcoholic liver disease can easily affected by jaundice. And the next is small red spider-like veins on the skin. Usually these people will have a small red spider web-like veins on the skins, and there will be the very dark or very pale skin. And usually there is the redness on the feet or hand, and itching in that places. So these are some of the skin problems or skin symptoms. We can easily found that our liver is getting affected. And the next one is brain and nervous system symptoms. These includes the problems with the thinking, memory, and mood painting. Usually, we know that the people who are having the habit of drinking can easily forget what they have spoken in that at the period of drinking time, and they will have the some thinking issues, and also they have a very weak memory power. And the next one is fainting and lightheadedness. Always they may undergoes fainting and lightheadedness. After that, numbness in legs and feet. Always they will feel some numbness in their legs and feet. This is the stages of liver damage. I have already said that the liver, the symptoms may shown with how bad the disease is. So let's see in the picture. This is our healthy liver. Usually, this liver has a capacity to regenerate itself or retreat itself. It will correct itself, but once it's fully gets addicted or fully gets affected by this liver, by this alcohol, it won't get retreat itself or regenerate itself. So in the first stage it is like fatty liver. There will be only the deposition of fat, and it may leads to some of the liver enlargement, because we know that it enhances or induce the inflammatory mediators. So it may lead to deposition of fat or liver enlargement. Next, there will be liver fibrosis. That is, there will be the formation of scar tissues forms. You can see the color difference itself. So the liver is getting worst. So there will be some scar tissues will be formed, and after that cirrhosis. Cirrhosis will be the last stage in the stages of liver disease. So here we can that the growth of connective tissues that it destroys liver cells. There will be the growth of some connective tissues which will destroy the liver cells. So these are the stages of liver damage. First, there will be the deposition of fat only. Next, it leads to the scarring, and next it goes to growth of connective tissues which destroys the whole liver. So it is fatty liver, then liver fibrosis and cirrhosis. Cirrhosis is the last stage of the liver damage. Next one is the what will be the changes in the liver, that is the fatty change. First condition is known as steatosis, that is only the accumulation of fatty acids in the liver cells. So we have already studied that the stages of alcoholic liver disease. So the first stage is also known as steatosis. Here is only the accumulation of fatty acids in the liver cells. These alcoholism can causes the development of large fatty globules, that is the macrovesicular steatosis, throughout the liver, and can begin to occur after few days of heavy drinking. When a person is socializing the heavy drinking, he can undergo the formation or development of large fatty globules, which may forms the macrovesicular steatosis. And alcohol here is metabolized by alcohol dehydrogenase into acetaldehyde. After that, the alcohol dehydrogenase into acetic acid, which is finally oxidized into carbon dioxide and water. And the higher NADH concentration, which induces the fatty acid synthesis, while decreased NAD level results in the decreased fatty acid oxidation. Therefore, there will be the triglycerides accumulation and results in the fatty liver. We have already, lastly, we have seen in this picture, there will be the increased NADH concentration. When there is an increased NADH concentration, there will be the reduction of NAD level. So when the NAD level is reduced, it may which may undergoes the accumulation of triglycerides, that is the fat. Once it allows the accumulation of triglycerides, which are resulting in the fatty liver. So this is the main mechanism which undergoes in the fatty change. And the next one is alcoholic fatty liver disease symptoms, mainly weakness, nausea, abdominal pain, loss of appetite, and malaise. That is, we have the person will always feel like they are not generally feeling well. And the next one is alcoholic hepatitis. Alcoholic hepatitis means the next stage of alcoholic liver disease. Here it is characterized by the inflammation of hepatocytes. We have known that hepatocytes are the cells which is present in the liver. Here between 10% to 35% of heavy drinkers develop the alcoholic hepatitis. The development of this hepatitis is not directly to the dose of alcohol. Some people seem more prone to this reaction than others. This is called the alcoholic steatonecrosis, and the inflammation appears to predispose to liver fibrosis. When there is alcoholic hepatitis, that is the formation of jaundice. So then further the hepatitis will lead to liver fibrosis. Actually, in these conditions, there will be the induction of inflammatory mediators like inflammatory cytokines, that is CNF-alpha, interleukin 6, and interleukin 8, that are thought to be essential in the initiation and perpetuation liver injury by inducing the apoptosis and necrosis, that is the cell injury or cell death. These inflammatory cytokines which increases the liver injury. The symptoms may include the pain or tenderness in the abdomen, jaundice, spider-like pains appears on the skin, malaise, fever, nausea, and loss of appetite. These symptoms they undergoes may initiate or tell us that our liver needs some needs some concentration. So these symptoms shows that your liver is in hepatitis condition. And the end says there will be the hair loss, dark urine, black or pale stools, dizziness, fatigue, loss of libido, bleeding gums or nose, edema, vomiting, muscle cramps, and weight loss. These are the certain other last stage of hepatitis symptoms. When these symptoms are arise, we know that it is in the last stage of our hepatitis. Next is cirrhosis. Cirrhosis is nothing but the late stage of the severe liver disease. Here it is marked by inflammation, fibrosis, and there will be the damaged membranes which preventing the detoxification of chemicals in the body, ending in scarring and necrosis. That we know that when there is too much of swelling, there will be the formation of fibrosis, that is the cellular hardening or some connective tissues which may prevent the hepatocytes to repair the liver. And next it is the damaged membranes can preventing the detoxification of chemicals in the body and ending in scarring and necrosis, that is the cell death. Between the 10% to 20% of the heavy drinkers will develop cirrhosis of the liver. Acetaldehyde is only certain compounds which is maybe responsible for the alcohol-induced fibrosis. We know that alcohol is metabolized into acetaldehyde. This aldehyde is very much responsible for the alcohol-induced fibrosis by stimulating the collagen disposition by hepatic stellate cells. And the next one is symptoms include jaundice, hepatomegaly, pain, and tenderness from the structural changes in damaged liver architectures. So this cirrhosis will be the final stage of the alcoholic liver disease. Next one is treatment. What are the treatments can we do to prevent this alcoholic liver disease or to somehow minimize the um, symptoms of this alcoholic liver disease? First is abstinence, next nutrition, drug therapy, and or final stage will be the liver transplantations. So first one is alcohol abstinence. Alcohol abstinence means there will most important therapeutic intervention for the patients with alcoholic liver disease. We have to stop the intake of alcohol. Abstinence has been shown to improve the outcome and the histological features of the hepatic injury, to reduces the portal pressures and to decreases progression to cirrhosis and to improve survival at all stages in patients with alcoholic liver disease. Usually, less than 20% of the patients will demonstrate progression of liver disease after abstinence. 5 year survival improves from 34% to 60% for those with decompensated liver disease. Those the people will have decompensated liver disease if they have undergoes the alcohol abstinence, they may have their survival improves up to 5 years, which is from 34% to 60%. So this alcohol abstinence plays a major role in the treatment of alcoholic liver disease. And the next one is nutritional diet. Though the people are drinking, they have to maintain a proper diet. Usually, they have to take vitamin A and K in their body or regular diet. Usually, the alcoholism is also associated with the nutritional deficiency. The presence of significant protein, calorie malnutrition is a common finding in alcoholics, as are deficiency in number of vitamins and trace minerals, including vitamins A, D, thiamine, folate, pyroxidine and zinc. These are the certain vitamins and minerals which is very much important for our day-to-day life or to maintain our body. So when there is deficiency in this nutrition, usually the person with alcoholic conditions or the alcoholics will mainly noticing this calorie malnutrition in their body. So the nutritional particular proper nutritional diet is very much important in the treatment of alcoholic liver disease. And the next one is drug therapy. First, we have to treat the alcoholic hepatitis. For that, we have to give corticosteroids such as prednisolone to reduce the inflammations. We know that these drugs are used to treat the inflammations. They mainly 4 milligram orally daily for 4 weeks, then taper the dose. When once there will be the changes in our liver, we have to taper the dose. Next is folic acid deficiency. Folic acid deficiency means to improve the folic acid, to improve the iron in the body, we have to take 1 mg orally daily in the conjugation with improved dietary intake until repletion occurs. Then, in order to treat the thiamine deficiency, we have to take thiamine 100 mg orally or subcutaneously daily for 2 weeks or until repleted. So these are the certain drugs which we have followed during the alcoholic liver disease. And the next one is not to treat vitamin D deficiency. Ergo calciferol, which is the vitamin D tablet, which is used to treat the vitamin D deficiency. Usually, the vitamin D deficiency can be treated by getting the proper sunlight in the morning. Along with that proper sunlight, we have to take this ergocalciferol, that is up to 12,000 to 50,000 international units orally daily, releases vitamin D serum levels in 2 to 3 months. The next one is vitamin E deficiency. That is, in order to treat this vitamin E deficiency, we have to take this vitamin E around 400 IU orally daily. Vitamin A deficiency can also be treated using this vitamin A. Though this vitamin deficiency are taken with the drugs, we have also to maintain the proper diet to rectify these deficiencies and to get the proper nutrition in our daily body life. So next one is silimarin. Silimarin is nothing but it has an antioxidative and antifibrotic properties which will be used during the later stage of the alcoholic liver disease, which can be believed to enhances the liver regenerations and to protect the hepatocytes from toxicity. Usually the recommended dose is 140 mg 2 to 3 times per day. And the final one is liver transplantation. Liver transplantation remains the only definite therapy when there is no other options. When there is no other options, we have to completely transplant the liver. The liver gets completely damaged. At that time only, we have to transplant the liver. The alcoholic hepatitis has been considered as an absolute contraindication to liver transplantations. So we from people who are transplanting the liver has to check the liver hepatitis test also. So these are the main things we have learned from the alcoholic liver disease. From the in this video, we have learned about what is alcoholic liver disease. Alcoholic liver disease is a certain liver disease which is caused due to the over or excessive drinking habit or excessive alcoholic consumptions. Though these alcoholic consumptions may be socializing, but there will be some pattern to take this alcohols. So certain risk factors also there in the alcoholic liver disease, that is to taking the women are more prone to the alcoholic liver disease than men, as the alcohol metabolism vary only 25 milliliter per day for the women, and we have also have some nutritional deficiency to minimize the effect of this alcoholic liver disease. We have to maintain the particular diet. And the next one will be, we have learned about pathophysiology. In that we have learned that the how the alcohol is metabolized in our body. Here mainly the alcohol is converted into acetaldehyde with the help of oxidation process. Though there is an oxidation process, they may produce a lot of NADH. When there is a lot of NADH, it decreases the NAD productions. When there is a decreases in NAD productions, it may leads to NAD production reduce, which may leads to triglycerides accumulation that may process to further progresses to the fatty liver consumption. So we have learned about what are the stages of liver. First stage will be the fatty liver, next will be the hepatitis stage, and the final stage will be cirrhosis. So we have to properly maintain a drug pattern, as well as um, we have to concentrate on our body and to avoid this alcoholic liver disease. Okay students, I hope you all have learned about this alcoholic liver disease. Here in this video we have learned about what is alcoholic liver disease, their pathophysiology, management, etc. In the next video we can learn about a new disease. Thank you.